Good afternoon, everyone. My name is Elian Adler. I'm president here at Allen College. It's nice to see everybody out here today. First, I do want to apologize for the weather. Fortunately, with our white coat ceremonies, we seem to have some really bad luck. We scheduled one over the winter time, and we had a blizzard, so we rescheduled it for a couple weeks later, and then we had a snowstorm that day, and we said we're not rescheduling again. So now today, of course, there's a huge thunderstorm. So I apologize you had to dodge the raindrops getting in here, but we appreciate you being here to support our students. So I just want to give a real brief welcome today to all of our guests in attendance. We have a great group of young men and women here who are dedicating themselves to the profession of nursing. And this is an incredibly important profession. As you all know, if you experience our healthcare system, you know that nurses are one of the most important pieces of our healthcare system. They work with our patients, they provide care and support, serve as a line of communication with all the different departments in the hospital, and this is an incredibly challenging profession to enter into. In the educational programs, the undergraduate nursing, the BSN program, is usually rated as one of the hardest undergraduate degrees of study in the entire United States. So the fact that these students are dedicating themselves to this profession is truly amazing. Today's ceremony really marks the transition as these students take the education that they're learning here at Allen College in the classroom and applying it to the clinical settings. They're going to get to go out and work and apply that knowledge with the patients out in the clinical healthcare setting. So I just want to thank all of you for being here and supporting our students. I know they cannot do it without you, and the fact that you're here today to support them is really very, very important and very special. So thank you for coming out today, and I hope at the end of today's ceremony that you get a chance to spend some time with the person or people you're here to support and just tell them how proud you are of what they're doing with their careers. So thank you for being here, and it is my pleasure to turn it over to Dr. Kendra Williams-Perez, who is the Dean of the School of Nursing here at Allen College, and she's going to bring some remarks on behalf of our nursing faculty.
Welcome to Allen College. As Dr. Seliger said, I'm Kendra Williams-Perez and serve as the Dean of the School of Nursing. It's our honor to have you here today for this white coat ceremony. These students will soon be starting their clinical rotations if they haven't already, and the white coat ceremony marks the transition to clinical practice. The nursing faculty are excited to continue this tradition for our students. Our first ceremony occurred in January of 2019. The white coat ceremony and student oath serve as an important rite of passage into the healthcare profession. The ceremony began with medical students at Columbia University College of Physicians and Surgeons in 1993. Since that time, the white coat ceremony has been adopted by the vast majority of U.S. medical schools and is becoming the norm in schools of nursing as well. This ceremony is made possible by the Gold Foundation, named for Arnold Perlman Gold, who was a world-renowned pediatric neurologist and a professor at Columbia University. His legacy lives on in the work of that Gold Foundation. This afternoon, nursing students will receive a pin for their white coat, and these pins have been contributed by the Gold Foundation. Students are encouraged to wear the pin on their white coat, and the pin reflects the mission of the Gold Foundation, which symbolizes trust, respect, and clear communication between healthcare professionals and their patients. These values certainly reflect the public's perception of the profession you are entering. The most recent Gallup poll in 2025 announced that for the 23rd year in a row, Americans rated the honesty and ethics of nurses #1 among a list of professions. You are entering one of the most trusted professions in the United States. It is now my honor to introduce Loren Brimeyer. Loren began her career as an educator after graduating from the University of Northern Iowa in 2013. After 6 years of teaching high school science, she came to Allen College to pursue her BSN in the accelerated program, graduating in December of 2021. Currently, she's working as a nurse at Allen Hospital part-time on 3 Medical and full-time with the Cedar Falls Schools teaching anatomy and physiology and in the Cedar Falls CAPS medical program. In her professional career, both at the hospital and in the schools, She enjoys working with students, helping them gain critical thinking and professional skills to prepare them for their future careers. In her personal life, she enjoys walking her dog, time in nature, and being with family. She's honored to speak today as the alumni speaker, sharing personal experiences about the importance of finding the people who support you through your personal and professional life. Please join me in welcoming Loren Brimeyer.
Good afternoon. As Dr. Williams-Perez said, my name is Loren Brimeyer, and I'm a graduate of the December 21 Accelerated BSN class here at Allen College. I'm currently working in the Cedar Falls Schools in the CAPS program, teaching CAPS Med, and there we help student associates develop professional skills, find purpose, and explore healthcare-related careers. To keep myself fresh on my nursing skills, I also work at Allen Hospital and through medical, and we work with patients with chronic illnesses that end up hospitalized just from being a little bit too sick to stay at home. So enough about me. I was asked to speak to you today about lessons or life advice that I have for you during nursing school. And if I may, I'd like to start with a story. So in our first semester of nursing school for Fundamentals of Nursing, we were asked to make a getting to know you video. And so I beautifully made my video, and when I posted, there was only one other person who made their video. So I decided to watch it out of curiosity. So the screen opens up, and this girl shows up, and her name, she introduces herself as Morgan Burger. She says, but you can call me burger, hamburger, cheeseburger, whatever, just don't call me late for dinner. And I said, I need to be friends with this girl. So on the first day of class, I sat next to her and I introduced myself, and let me tell you, that was one of the best decisions I ever made. Over the next 15 months, we were there for each other through thick and thin. She helped me conquer the technical skills and the pesky ABCs of clinical nursing, and I helped her work through the fact that why is always the wrong answer in mental health nursing. We were there to cheer each other on with our successes and help pick each other back up when things got tough. And so fast forward to our first nursing jobs, we both started working the night shift at Allen, her in the ER and me on through medical. Let me tell you, that was tough. It may seem obvious, but being a new nurse on nights is hard. You're trying to meet new coworkers, you're facing new problems, you're trying to keep people alive, and it's all on like 4 hours of sleep that are like really bad hours of sleep. So again, we were there for each other. At least once a month, we would try to meet up for breakfast to debrief on whatever crazy things or hard things we'd seen that month. But these visits became hard to come by, and I had to start relying on my immediate circle that I was working with. So I met Amy, the patient care tech who'd been with our unit for years, who always helped me find supplies. I met Debbie, the nurse who'd been at Allen Hospital for 40 years, and I knew that I could rely on her when my patient was starting to look bad. And I met Kristen, the young, snappy nurse with higher expectations and more kindness than I could ever imagine, and who helped shape me into the nurse I am today. So I'm assuming you all voluntarily signed up for this 12-month BSN program, and I bet with that crazy drive to complete your degree in such a short amount of time, most of you are hardworking, independent people who would prefer to do a job by yourself because you know you can do it right. Maybe that's just me, but that's how I feel. So either way, you're going through this program and entering this profession as a new nurse, you won't be able to do it all on your own. This is a tough program, a tough profession, but the good news is that nursing is a team sport. During school, you'll need to learn to ask for help from your classmates and your professors, form study groups, help where you can, and get help when you need it. When you enter the field, seek out more experienced nurses and patient care techs and unit coordinators to help you with the day-to-day work, as well as with your sick patients to make sure they get the care they need. Believe it or not, there will always be days when your patient is really sick or needs lots of emotional attention, and you'll have to rely on your fellow nurses and coworkers to help take care of the rest of your patients. Asking for your help is not a sign of weakness, and there will come a day when your coworkers are also having a terrible day, and you'll be there to support them just like they supported you. My message to you all as you go through these next few semesters is to remember that teamwork makes the dream work. Help where you can, but don't be afraid to ask for help when you need it. It's far more dangerous to assume you know all the answers than it is to ask a clarifying question. Today, you all join a long-lasting tradition of quality nursing education, and we, your family, professors, and community are all very proud to see you all with your white coats. We cannot wait to see where your nursing career takes you. Thank you, and congratulations.
are going to start with our coding ceremony. We have Jennifer Coleman and Allison Stone, along with myself, Ashley Linda. When I call your names, go ahead and enter, come up the steps, and then we'll start with the coding. Okay? All right. Angela Aglaberdieva. Sydney Bus. Noah Christian. Julia Costello. Madison Even. Brandon Hendrickson. Samantha Harridge. Rachel Hoffman. Erica Jordan. Zoe Krenz. Ava Lowdy. Mackenzie Meyer. Nicole Pazorski. Michaela Randall. Austin Siebert. Ainsley Slade. give them a round of applause. It's now my pleasure to introduce our student speaker for today, Jenny Wang, who is a student in our accelerated nursing cohort that is scheduled to graduate in August of 25.
Thank you, Ashley. Good afternoon, faculty, students, and honored guests. My name is Jing Liu, Jenny Wang. I'm a member of the accelerated BSN class of 2025. I'm honored to stand here to share with you my experience in Allen. Like just 1 year ago, I was sitting exactly where you are now, as I can't believe that I'm now less than 2 months away from my graduation. I guess that time does fly when you're busy. I still remember the first time I stepped into a patient's room with my clinical partner to complete an assessment. We felt like intruders. Face flush, voice shaking, just like now, and hands trembling, just trying to take a set of vitals. But our clinical instructors teach us, encourage us, debrief with us, and walk us through along the way till we get comfortable enough for the next challenge. Literally, I remember one clinical in particular. After we expressed anxiety about not yet practicing IV insertion on a real person, our clinical instructor, Joey Wilcox, stood up, rolled up her sleeve. I won't go into details, but that day, she left the building with 5 band-aids on her arms. By saying that, I'm not suggesting that all instructors should practice pincushions, but I share this story to highlight just how deeply our faculty care. They meet where we are and do whatever they can to help us succeed. Beyond clinicals, the support continues here on campus. The faculty and staff are caring, approachable, and always looking out for us. Student organizations offer valuable resources. Our instructors go above and beyond, not just because they are teachers, but because they are nurses who understand the challenges of this journey. Their caregiver personality naturally extends to us. As a non-traditional student, I've attended schools in 2 countries, 5 states, and 6 colleges. Allen is the only one that the faculty always carrying candies around to try to lure you in so they can help you academically, physically, or mentally. I once joked with a professor that Allen is mostly operated by a bunch of moms. And honestly, it's true. Like moms, they care deeply, they push you, and they want you to succeed more than anyone else. Seriously, I got advice from my professor on things like dealing with difficult situations in clinical, making career choices, and training my kids to sleep alone. Thank you, Jennifer, I'm still working on it. The team here is incredibly thoughtful. They carefully plan out your schedule like a perfectly fitted puzzle. I can't believe how you do it, Anna. They listen to your feedback and adjust accordingly to enhance your learning. They expose you to as many aspects of healthcare as possible so you can discover your passion. And if they're not enough, throughout the year, they bring in professionals from hospitals, clinics, and the community to expand your knowledge and perspective. I could never list everything Allen has provided for me, but I can tell you this. Allen will do everything possible to support your success. All you need to do is ask. And as we always say here, we will figure it out. The year ahead will be challenging, but if you give it your all, it will also be one of the most rewarding years of your life. Family and friends, your support and understanding will mean everything. Students, we cannot stress this enough. Don't be afraid to ask for help. and don't forget to take care of yourselves too. There are so much more I'd love to share, but I know you're ready to wrap up the day, so I'll end with something Joey once said in clinical that inspired me and stuck with me. Go, grow, and become the kind of nurse you wish you could have. Become the kind of person you wish you could be around. And when the time comes, sooner than you think, become the kind of instructor that you would like to have. To the class of 2026, welcome to Allen College. The year ahead might suck sometimes, but you will love it. Good luck, you got this.
Thank you, Jenny. I've attended a lot of these, and that's like the most animated we've ever gotten. So again, I think another round of applause. I think we maybe have a new salesperson. Like, wow, I was very impressed. So, my name is Anna Weepy. I'm the assistant dean here. I really manage the BSN program here with the help of a lot of great faculty and staff that we have here at the college. So what we're going to start with first is I'm going to lead you in the nursing pledge. I stole Ainsley's copy, so I have it, so I don't have to try to remember this. So I want you guys to all stand up, and I want you to turn and face the audience, because you don't need to say the pledge to me, you need to say the pledge to the people who are here to support you. So I will help lead you in this, but you guys are saying it with me, all right? Okay, here we go. As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns. Act in a compassionate and trustworthy manner in all aspects of my care. Apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients. Exercise sound professional judgment while abiding by legal and ethical requirements. Accept the lifelong obligation to improve my professional knowledge and competence. Promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this pledge voluntarily with the full realization of the responsibility with which I am entrusted by the public. Congratulations. So I just have a couple remarks as we finish up here. This white coat ceremony is really marking the beginning of a journey. As I think both of our speakers shared, it's really a journey to become that professional nurse and really hopefully become that nurse that you want to be taking care of your family and your friends and your coworkers. And hopefully here at Allen College, we're able to provide you with the education and those experiences to do that. So, by putting on this white coat, you really are starting to become that professional nurse, and hopefully really you see that in your clinical experiences as you move forward. So you probably have gotten here so far with the guidance and love and support of a lot of people in this room. And as our speakers have mentioned, be sure to use those people and the new cohort or friends that you found, maybe potentially coworkers, all of your new besties as you continue in nursing school. My daughter graduated here 6 months ago, and she said her best friends came from our nursing program. So hopefully you find that with who you connected with. Lauren mentioned Morgan. Is Morgan still a bestie? Even though you might not talk to her all the time, you probably can pick up where you left off. I actually have somebody, I graduated from here, and my friend that was my best friend in nursing school lives up in Cresco. I've seen her like once a year when we go up to the track meet in Cresco, and we can pick up like we've never left. So hopefully, again, you guys develop those relationships and know how important it is to have those relationships in nursing school, because nursing school is not necessarily fun, right? And you guys have chosen your hard. When I speak to prospective students, I say, you pick the 2-year route and you have hard for 2 years, or you pick this 1-year route and you just have really hard for a really quick amount of time. So just know that in 12 months, or actually now we're down to what? 11 months? Who has the countdown? Anybody have a countdown? It's 11. Do we have days? Do we have days? No days yet. Okay, you might want to think about that because we're getting probably closer to the 300 mark before this is all over. So again, congratulations, and I'm excited that you guys have chosen Allen for this journey of your nursing education. We will leave all of this stuff up here, so we'll do a group picture first, so we'll have all the students come up and get a group picture, and then we can move the table out of the way. You guys can take pictures with family, friends, no rush at all. Tour your family on campus if you want to show them different spots of the school. You are more than welcome to. So again, thank you guys for coming, and congratulations on getting your white coats.